So welcome to the Trust Board April meeting, and welcome to anybody who's joining us virtually on the live stream event. We've done things slightly in a different order this morning. For confidentiality reasons, we've just heard from our patients and their family and our staff on our patient story. So we'll now start the main bit of the meeting. So item 1, apologies for absence. Jenny, I think we've just got Mike Smith, is that correct?
That's correct, yes.
Thank you. Item 2, declarations of interest. You've got the updated paper in the board papers, and if anybody's got anything where they need to declare an interest with anything on the agenda, please do so, and if appropriate, excuse yourself from the discussions and decisions. If we can move on to minutes of the meeting held on the 31st of March, are there any points of accuracy that you've not already let Jenny know? No. Any actions arising that are not on the actions tracker? No, we'll take those as a true record then, thank you. If we can move on to item 4, which is the actions log and matters arising. Anything on that?
Chair, just to let you know, I've now got dates for the MAPA meet training.
That's really good, thank you. And I think Mike was also interested. Michelle?
Sorry, Chair, I must have missed it, but can we just add to the strategy refresh? We have got a timeline now together for the strategy refresh, so we just need to populate that with the date it'll come back to board. So if we can do that outside the meeting, that'd be helpful.
That's great. That was going to be one of my questions, because I know that you updated us at the last board meeting that was going to be a stock take and it was going to come back. So no, thank you. If we could just circulate that round in the meantime, Jenny, and update that action, that would be really helpful. Thank you.
Chair, okay. At 3621, the Audit Committee Assurance Report, the audit plan has been to FIC. So we've seen the audit plan as it was requested on there for each committee to do.
Okay, thank you. We can update those as they go through. I think I've attended most of the subcommittees, and I think it's been going to quite a few of them actually, and it has now been circulated round, I think, the rest of the board as well, so that everybody's seen a copy of it. Okay, thank you. Anything else on the actions list? No? Then if we can please move on to item 5. We've had the patient story, which is item 5, so item 6, which is my chair's report. Just a few things to cover this month. So I'm pleased to report that at the Council of Governors meeting recently, they reappointed Mike Smith. His term will now expire on the 31st of August 2022. So congratulations to Mike. And the associate non-exec position is progressing well, and we should be going through the process, and we'll keep you all up to speed. I know that most of you are involved in the process in some way or another, but that is progressing at the moment. Just in terms of usual activities and meetings, the governors have been very busy since the last board meeting. I've continued to meet with the public governors, the lead governor and individual governors, and we've had some really good sessions with the governors. So we had a development session, I think it was last week, and my thanks to not just the non-execs, but to Pete, who did a double act with Francis on a really good financial session, and to John and to Hilary, who came along as medical director and director of nursing and allied health professionals, just to have time to have a conversation with the governors. And I think that went really well and was valued by all. And thanks to Michelle and Alison, who hosted a session on the integrated care system, an update for the governors last Friday. Really useful there too. I've continued to meet and have conversations with various members of staff, individually and otherwise, and also it's been continued to be quite a busy time in the system, the ICS work. So I've had extra meetings on encouraging board diversity and attended the Humber advisory board, where the focus at the moment is on health inequalities, but with an up and coming session on mental health. In terms of external, I have had some good meetings with various partners and stakeholders, including the chair of Tees Escombe Weir Valley, to discuss working together and how things are going. So I think that's all, unless anybody's got any questions. No, thank you. Well, in that case, could we please move on to item 7, which is the Chief Executive Report. Michelle.
Thanks, Chair. Good morning, everybody. I'm taking that you've read the paper. I'll pick out a couple of points as always, and then just throw it open to questions. It's been another busy month. Still getting around the staff virtually, which is really great. Staff morale remains really high. We have got tired and fatigued staff. So our next reiteration of our, valuing and rewarding staff is around our recovery restoration plan and programme, and we're doing a lot of work. Steve's leading that, which is great. We're doing a lot of work about asking staff what it is that they really need in relationship to that recharging of batteries over the next few months. So more on that later. It'll certainly involve the workforce committee, and we're having some really good conversations about how we do that and whether we have a thank you week or individual celebrations and things, just to say thank you across the patch. So more on that later. The commissioning directorate is gaining some momentum. Obviously, we are not in shadow form yet in relationship to the Provider Collaborative, but there's lots of work going on, and it's really great to say that we're welcoming Dr. David Harvey into the team in relationship to that as clinical director, already having an impact, coming across to us later on in the year, currently working at Leeds and York Partnership. Mental Health Awareness Week, we've got a little bit in there around what we're doing. We're doing a lot more than that, just gives people a flavour, so please have a look at our website. It's the 10th of May to the 16th of May, so we're doing a lot, as you would expect, with the system as well as internally as well, and our staff, and it should be a great week, so please participate in some of that work. It was great to get the thank you from the Health Education England, just to thank us for the support that we've done over COVID and the pandemic. It was really pleased to see that, and we've circulated that around the organisation. I've noted that Matthew Taylor's been appointed as the Confederation Chief Executive, and giving you a little bit of an outline of Matthew's background. Moving on to some of the main body of the report, great to spend some time actually during the month and see the developments in the community mental health teams, and I'm sure Lynn can pick up some more if the board are interested in looking at more detail, but really great to see how that is beginning to really develop full recruitment, but really starting to link into primary care, because we are continuing to exhibit and have a lot of capacity and demand issues across our services. So once we get that transformation, it should start to hopefully alleviate some of that pressure. I'm going to pass over to Hilary at the end to talk a bit through about the quality accounts. There is a piece in there, so Hilary, if you don't mind picking that up at the end, that would be really great. Thank you to everybody that participated in Social Values Week. If you remember, we had a social values report. We ratified that at board in September, and we had a whole week on that. And thanks to John and the team, I've dipped into a lot of sessions. I thought it was really great work, and really good to publicise the social values aspect of our work as well. There's going to be quarterly staff surveys now that come out, and I think that will really help with our work in relationship to rewarding engagement of staff and really listening and feeding back to staff. Lots and lots on, as I say, on the communications. We are going to hear from Rachel. She's going to pop along towards the end of the meeting to talk about the operational plan. So anything about communications we can pick up later. And that there's a lot on the health stars who are doing a lot in the background. I just want to also mention recruitment, because it is in the report, but if you remember, we did talk about relocation packages, and we've started to advertise those as part of our unbelievable recruitment campaign. And suffice to say, looking at Steve and Lynn, that's having a bit of a positive effect. It looks like we're really getting a lot of interest in our hard to reach, especially our hard to reach. And we mentioned Inspire. So we've been really targeting Inspire so that we can maximise the staff and the bed occupancy there, and we've got some really good candidates interested because of not just because of the organisation, but because of things like the relocation package as well. Plus, our reputation is really improving in relationship to being a good employer of choice, which is part of our objectives and strategy. Just for your diaries, really, it's not included in the report, but 12th of May is International Nurses Day. So there's lots and lots will be happening in relationship to that, and we'll celebrate our fabulous nursing staff on the 12th of May. Lots happening in the integrated care system. There is something in part 2 about the minutes of where we're up to. We're developing those geographical partnerships, supremacy of place, and I'm continuing to lead the provider collaborative work, which is developing across the patch. But I'll stop there, Chair, and I'll answer any questions. And obviously, I'll pass over to Hilary if you just want to give us a little bit of an update on the quality accounts, Hilary, that would be really helpful. Thank you.
Yeah. Thank you. Thanks, Michelle. Francis, did you want to ask something before I?
If you could just do your update on the quality, then we'll take questions. I'll go through my list. Thanks.
All right, just saw Francis' hand pop up. So the quality priorities are in Michelle's paper of section 4.2.3. They were approved at the last quality committee. You can see they've been to EMT, there's been consultation with our patients, carers, etc. through Mandy's groups. They were the transformation ones that we agreed last year. If you remember, we had to agree 3, we agreed 4. Not knowing obviously we were going to go into a pandemic at that time, and that would be rather challenging. There has been progress made, and I've had a discussion with Sharon, and what we've agreed is in the next paper to the board, in Michelle's paper, I'll put a bit more about the progress we've made this year and also the priorities going forward, so that the board are cited on that complete picture. I'll also put into the next one where we're going with quality accounts, because it appears this is probably at the last time we'll be expected to produce them. That going forward, they'll beef up the annual accounts, and there'll be something in there more about quality and performance. So it's all in one document, which really does make perfect sense, because there's a lot of overlap between the annual report and the quality accounts, and they're quite an industry to produce. So we'll see what that starts to look like going forward. But hopefully by the time of the next board paper, I'll have a little bit more information on that, and I shall pop that into Michelle's report, so we can look at that, and any further discussion and comment on that we can have next month.
Thanks, Hilary. That's really helpful. And as you say, we've had some useful discussions. So we'll do that for next month. That'll go into the Chief Executive report for next month, as Hilary's described. And I think the quality accounts, did you say they're coming back in the July board?
July, yes. Yeah.
Okay, no, thank you. I'll just come to exec colleagues, if I may, just before we take questions. So just Steve, is there anything you want to add to the relocation policy comments or anything else?
No, just really positive. I think we know we've had 3 nurses for Inspire, 1 from Wales, 2 from Sheffield, who have accessed that scheme. So we talked about it in Workforce and OD. It was part of a suite of initiatives that we've put in place to support it, and it's great to see that coming through, and frankly coming through so quickly as well. So hopefully we're on the right lines with some of the things we're doing there, and we'll continue to see take up on that scheme.
That's great, thank you. And Michelle Hughes, I'll come to you.
Thank you, Chair. It was just to pull out a couple of things on communications, because with such a detailed report, I just wanted to pull out one in particular. So board will recall that we invested in a system for tracking and targeting staff engagement. And we often hear how staff don't open or read emails, but Popolo is a system we now use, and it's evidencing that just over the last month, the open rate for internal emails was 71%, which is above the national average. So this is demonstrating that although we would always aim for 100%, our workforce is largely engaged in our internal communications, which is fantastic. There's some great statistics as well for Humberleavable and Join Humber websites. And just to finally add that our brand continues to be embedded with workshops continuing with and the resource on our intranet. The accessing of information and materials had 1,200 page views in March alone. So just some fantastic stats in there.
That is fantastic. Thank you for sharing that, Michelle, and bringing that out, because I mean it is a fantastic success, and well done to the comms department for leading on that. Really good. So we'll go into questions or comments now. So Mike Cook.
Thanks, Sharon. Thanks, Michelle and the team for again a really good progressive report. Great to hear policies having impact like that. Recruitment boost. Well done. Just 2 specifics, really, if I may. On 4.13, we talk about the really good progress on community mental health teams. Obviously, we've had more capacity into those, but waiting times of 4 weeks are impressive. And I suppose what I want to just make sure is that in the restore work we do, and in the waiting list work that particularly Claire is leading, and we had a good discussion at Quality Committee about it, that we're using the learning both in the community mental health teams themselves on how they've got to the access and how they've held it at that, but also how they've worked with primary care networks too. So I'd be just interested from Lynn, really, how we're going to really maximise the learning. So it's not just down the silo, it's right across all of our community services offer, that hopefully can put the resilience in those services so there is less waiting over time, because some of the trajectories are worrying because of the big pent-up demand there is.
Thanks, Lynn.
Yeah, I think that's a really good point, Mike. Thanks very much for raising it, and obviously sharing that learning, good practice in terms of making those waiting times even better and resilient, given the demand pressures that we've got at the moment, is absolutely the focus of the work. And obviously having Claire really connecting across the services, she's certainly pivotal in making sure that that happens. But you know, I'm just so pleased that we were successful in the early implementer bid that we submitted for the CMHT primary mental health care transformation. It's proving such an asset at this particular time. It would have been anyway, but given the pressures on primary care, that's really what we're able to sort of see, that step change that we hope to see. So being able to support our CMHTs with those waiting times and with that extra capacity and resource focused around primary care, not only do I think it's actually going to change significantly service user experience around having that care integrated, in the community, but to really support the CMHTs to maintain those waiting times and be focused on the complex interventions, which is what they need to be doing. And given the impact on COVID that we've seen, not only is it an impact in terms of demand, but we've seen that rising complexity too. So I don't disagree, it's an ongoing challenge, but I think we're in a really good place because of the work that we've done, and we didn't take our eye off this work through COVID, as you know.
Yes, and I fully accept that, and I'm really pleased to see that. What I think I'm getting at is the bits we're looking at with the resources and the change management and all the sort of learning we're doing well in, but it's those bits that we're not quite shining a light on that then atrophy. So it's how we sort of bring the whole thing up over time as part of the recovery. Thank you for that. The second point was 4.46. Great, we're reviewing education across the trust. What's the objective and who's doing it?
Do you want me to take that one?
Steve, would you like to pick that up? Yep.
Yeah, sure. So it was a discussion that took place in EMT, Mike, about how we currently provide. So we've got that spread across a number of areas in the organisation in different teams. So the request through EMT was to do a review of that, see how we currently deliver it, see who has a role in that, and to come forward with suggestions about whether we could do that more efficiently, whether we could exploit what we do better, so academy type status, some of the work that we could do. So the person who's doing it is a person called Karen Vella, who works at Leeds Teaching, who also does some work around this and has set similar things up in that part of Yorkshire. So very skilled, very knowledgeable about this. I think Dean may have some experience of working with Karen as well. So Karen is talking to key individuals in the organisation with a view to bringing back a paper that is a discussion paper for us in EMT to think about proposals to move forward, Mike.
Okay, Mike.
Yeah, thank you.
Thank you very much. Francis?
Thanks, Chair. A couple of comments and the odd question. I really like the stuff that Michelle talked about in terms of Mental Health Awareness Week, and just a kind of left field idea. I don't know whether or not there was as too late to maybe do a competition. It just sounds very similar to the country file calendar, which I buy every year. And if staff are doing pictures, we maybe have a competition and have some form of calendar, and maybe Mike with his wildlife hat on could judge some competition for us and see what some ideas. Just a thought. Bit left field.
No, I can see some smiles around the room, so I'm imagining discussions are being had elsewhere. Michelle are smiling, so I think we'll pick that up outside the meeting, but it sounds like you're on the page already, Francis, so carry on.
Then just to back everybody on the community mental health stuff, read that, looks really good, sounds really impressive with what is going on there. On the quality priorities, I just wanted to check that they're great and we've been doing them, but they don't seem particularly smart in terms of measurement, in terms of how we actually assess what we have achieved. So maybe not want to answer now, but just a thought on that one. Like Michelle, I attended a couple of the social values report sessions that John ran, which were really good, really interesting. I learned some good stuff in some of those. There's some great presentations. So just to compliment the team on that. And then on apprenticeships, I thought the apprenticeship work that's going on looks really good, and continues to be. You know, apprenticeship seems to be a growing area with the government. And I know with my head on at Leeds Beckett, we're getting lots more apprenticeships coming through, doing diplomas, degrees and masters through the apprenticeship scheme. So it's really good to see that kind of stuff going on.
Thanks, Frances. And Hillary's going to pick up on progress against the quality indicators at the next report. So hopefully that'll answer your question, Frances. But thanks for those points. John?
So just to pick up the comms stuff, and particularly the use of Populo and some of the, you know, we really have transformed over the past 2 or 3 years our approach to communications, and particularly getting that sort of feedback from staff. I suppose the interesting thing that we've learned from COVID is even incredibly important topics such as COVID vaccines still may only result in a certain number of people opening key emails. So we're kind of left in a situation where 80% of the people read the stuff, which is fantastic, but we have a hard to reach group, which is about 10 to 15% of the organisation. And we can see that right across the stuff and some of the things we're doing. So I suppose the challenge is for us, how do we sort of reach the hard to reach group in terms of the 15% of our communications, whether that's more visual stuff, texting, whatever that's going to be. I know we don't have the answer, but actually in terms of improving a lot of our metrics, it's the last 15% which are, dare I say it, the final barrier that we need to cross.
No, thanks, John. And it may be something we can pick up with Rachel later in the later agenda item, but it's a good point. And obviously, we also appreciate that not all our staff are on email systems as well. We've discussed that before. Peter?
Thanks very much, Sharon. Yeah, I was just interested to read about on 4.1.1 about the older people's acute community services and the great work done on that pilot. You know, great feedback there from 14 users of that service, and it seems to have had a real impact on inpatient activity and a reduction there, which is very important, that people can stay in their own home environments if at all possible. Well, I just wanted to ask a question really on the trajectory for inpatients beds on for older people, given that we've got extra capacity going into Maester Lodge, and we've done this work on the pilot, which I'm hoping will continue. Will that mean that we will have spare capacity in the future? Will out of area beds be a thing of the past? I mean, how do we see our capacity there going forward? Is this going to answer a lot of the issues that we've had in the past?
Shall I pick that up and then I'll bring in Lee? I mean, the idea of the Maester development was to put the capacity in relationship to the numbers we've got out of area, and we did a bit of capacity planning as well. Though obviously capacity demand is increasing all the way through, and obviously we've got some COVID restrictions as well about how many beds we actually can get in initially because of the COVID restrictions. But I'll pass over to Lynn, but that's a strategic headline. But Lynn, any more detail on that?
Yes, thank you, Michelle. So obviously, you're absolutely right, Peter. Those are two intentions, obviously, as Michelle says, when those Maester beds fully come on stream, that will bring us much closer to what our demand modelling actually says. Obviously, what we've seen through COVID actually is a further increase in demand, particularly in relation to functional older people. And I guess we are looking at sort of what's happening with that, but you know, how long that will continue for, I think we've just got to monitor that very closely. Like you say, the early findings from the acute community service pilot are really encouraging. It's a model I've worked with elsewhere as well, so I was really pleased that we were able to introduce it. So I think that's really encouraging. I think, as the piece says, our plan is, particularly when it's you know, we can do it within COVID safe working arrangements, is to increase that capacity in that service. So I think with both elements of that, but I think there still is some, you know, hesitation Peter, around that ongoing impact of COVID, particularly on older people, that we really need to pay close attention to. But undoubtedly, that increased capacity is getting much closer to us being able to meet our demands. So I'd really hope that we continue to see, you know, benefit in terms of that reduction in reliance of out of area beds, and all the negativity that brings for not just service users but their families too.
Thank you. Thanks for that, Lynn. So Steve?
Yeah, thanks, Sharon. It was just to add one addition, really. We were contacted earlier in the week by NHS employers just in recognition of our positive staff survey scores, particularly around staff engagement. And we've been asked if we will attend and do some showcasing of some of the work that we did, which is great. And obviously I've accepted that offer, so I will go along to those meetings and we'll do some promotion of some of the things that we talked about at the last board and our positive results.
No, that's great to hear, Steve. And if you wouldn't mind just giving us an update, perhaps in the next report for next month, that would be really great. But fantastic recognition for the improvement that's happened. So well done to everybody for that. Pete Beckwith, sorry.
Thanks, Sharon. I was just going to draw attention to the capital programme. You know, I think when we took it through execs and finance committee, we've got a really ambitious capital programme this year. You know, we're planning to start some of the works at the Humber Centre that are long overdue, and I think it's testament of the journey we've been on. But I think, you know, the amount of internal resource we put into capital this year is probably triple we have done in any other year. So I just want to draw that out, really.
No, it is a good point to make. It is fantastic to see, Pete. And I have to say that that's the first time I've seen a capital programme like that in a lot of years. And we've not been in a position to be able to do that. So it is good, and particularly in the challenging circumstances we find ourselves in. So really positive, and it's a point well made. So thank you for that. Steve, is it a legacy hand or is it a new point? I'm taking that's a legacy hand.
Sorry, legacy hand.
No, that's no problem at all. So thank you. Some fantastic things going on. Busy as always. Fantastic to see, despite the challenging circumstances, everything's just progressing. So much positivity going on. There's just one thing I'd like to do. I just, on behalf of the board, just like to thank Stella Morris for her work as Director of Medical Education. John, if you could just pass that on to Stella for me, please, because she's done a fantastic job, and a lot of us have seen firsthand the amazing impact she had in that role. So thank you. And it's great news that Soraya is taking on the role, and I'm sure she'll be fantastic in post as well. So congratulations to Soraya, and a big thank you to Stella Morris for all her hard work in the role. So thank you. If we could move on then please to item 8, which is the publications and highlights report. Michelle.
Yeah, thanks, Chair. Again, it's just there for any comments that we've got, obviously feedback from each of the directors about how those publications will be used. So I just don't need to question, Chair.
Thank you. Mike Cook.
Thank you. You can call me a pedant today, but a strategic one at least. I really appreciate this. I think it's a really good scan. I did find one that I thought was particularly interesting, though, that I got sent, and it's about the COVID generation, a pandemic in mental health in the making. And it's an all-party government report on healthy childhood. And it's worth a dip into. It's sponsored by MQ, and I've passed it to a couple of people who said it was useful. So I just thought, for strategic discussions, they're the type of things that might just stimulate something, maybe a development session or something, because there's definitely something around that we need to think about. And I think we need to have more than one go at the strategy. So it's great that, you know, it's coming, the strategy refresh, but I think that's important work for the board to contribute to, not just receive.
Absolutely agree, Mike, and we did touch on that slightly at the last discussion about it. So absolutely, the board will be involved in forming and reviewing the strategy, absolutely. And it was a useful link that you sent round, actually, and it may be worth us just sending that round the rest of the board, actually, Mike, if that's all right with you, because I think it was an interesting read. Peter?
Thanks very much, Sharon. Yeah, it was just around number 2, which is a very important area. I think it's about the new dedicated mental health services for new expectant and bereaved mums, and the work that's being done for these new hubs. And there was some timelines there. I was just wondering, in terms of the timeline for our area, have we got something to work to yet, or is it still work in progress? Date to work to.
Shall I pick that up? Yes, we did. It was actually really positive, to be honest, Peter, because we got our fast follower, which means that we are only one of 10 sites, I think, that are now on that. So we've got quite detailed plans, which I can circulate links to, and we've got a programme lead as well within the integrated care system. So there is lots of work ongoing in relation, because it is really important, and it builds on some of the work that we've done on our perinatal service, both in Humber and external around Humber Coast and Vale. So yes, and I think because of the detailed plans that we submitted, that's why we managed to get some of the funding directly into Humber Coast and Vale. So I'm happy to circulate that outside the meeting.
Thanks, Michelle. That's helpful. We'll take that as an action, Jenny, please, to do that. And presumably some of it will be picked up in. We get a report, don't we, in part 2 about some of these regular updates. So thank you. Anything else before we move on? No, thank you. Then can we please move to item 9, which is the performance report. Pete.
Thanks, Sharon. So this is the performance report as at the end of the financial year. So the report comes in the usual format. Just a few highlights and then move to questions. So some positive performance there, particularly on training and sickness, which I think is important to note. Cash does remain high, but due to year-end and timing of receipts and payments, it is higher than our underlying position, which is roughly £22 million, but that is still positive for the trust, given our journey. And just in terms of commentary on waiting times, we, myself and Lynn have had a conversation about establishing an oversight group just to look at performance information to ensure we're reporting it as accurately as we can. We've attached a lot of information to ASD, 52 weeks wait, and that work will progress over the next couple of months. I don't know if you want to add anything on that point, Lynn, before we go to questions.
Yes, thanks, Pete. I will add a little bit more if that's okay. So as Mike Cook has already mentioned, there was a fairly detailed update that went to the last quality committee. I hope Mike can comment that really demonstrated that we really are doing some very forensic work around all the waiting times that are over 52 weeks. Obviously, it's not a satisfactory position. It's not where we want to be. However, what we are doing is through Claire Jenkinson's, the Deputy Chief Operating Officer's leadership, really working with teams. And I think as well, what Claire is picking up, is that this, yes, it's about service user patient pathways, but it is as much about sort of cultural and different approaches to some of this, and also sort of sharing some of the practical learning as we've touched on already. So I'm really confident in that work. It's a very engaged piece of work that Claire is leading, but it is to the level that, certainly in terms of the over 52-week waits, this is an individual patient level detail of work, which is great. So in terms of ASD, Pete, there are some data quality issues that we've uncovered, and I guess that's not surprising, really. So I can certainly update that the appendix demonstrates sort of the trajectory where we are. There has actually been some further improvement in relation to that. So in terms of these riding, the ASD caseload has reduced further. It's at 199 overall in terms of numbers waiting. Hull's at 881. That's an overall reduction in 52-week waits of 20 service users. So I know the numbers are still a bit smaller than I'd want them to be, but it does demonstrate the pathway changes are taking effect. We've also commissioned some additional capacity in terms of support with diagnosis using a digital platform, Helios. That doesn't come into play until end of this month as well. So I'm pleased that we're already seeing that within the resources and capacity that we've already got. That additional capacity will come on stream as well. Haven't actually incorporated that into the trajectories yet, so we will be adding that in too. So undoubtedly it's improvements. We need to see more, but I am confident we've got the right actions in place, and I'll stop there.
Thanks, Lynn. And Pete, that's really helpful, because it is obviously always a topic of concern and interest to the board. Peter?
Oh, hi, Sharon. Yeah, it wouldn't be a board meeting without me asking on the dashboard. Sorry about this, but just a couple of or 2 or 3 red flags just to ask questions about, if you don't mind. I know the sickness levels are going down generally, and the figures generally on sickness are really very good. But in the units, most of them are still flagging red. It was just an observation, really, that it's still a bit of an issue in the inpatient units, where it's possibly more difficult to sort of you can't stay at home working like you can if you're a clerical member of staff, for example. And just on clinical supervision, we talked about Inspire, didn't we, earlier, and the great work there, but this clinical supervision rate has dipped there, and at Townend it's dipped as well. I just wondered if there are any issues there that we need to be concerned about, or is it just a temporary thing that's corrected in the next month?
Thanks. Hilary, would you mind coming in there?
Yeah, that's fine. Thanks, Sharon. The sickness, yeah, I mean, this is February. February was a lot of pressure on the services. We still had some, obviously, COVID prevalence around, obviously still around now, but it was quite high in February, and that's obviously impacted as well. That sickness is coming down. I haven't got the figures for each and every unit, but I am assured, and Lynn's nodding, that the sickness is starting to come down now in those inpatient units. And I think that's part of some of the reds on the clinical supervision with those additional pressures. And of course, when you've got pressures, you do really want them to be having clinical supervision, but unfortunately it's not always the case. But I've checked, we got the latest report came through last week, which is obviously after this report is done. Ullswater, which was flagging red, is 92%, the clinical supervision. Townend Court is 75%. They've had a few issues there, very high acuity and vacancies, and next week they've got some interviews with some more registered nurses. They expect after that they will have all of their RN vacancies will be filled, so that should be good for them as well. And I said the acuity there has impacted on them. And the CAMS unit, Inspire unit, 91% is their latest figure, so very much looks like it was a bit of a February blip.
Thanks, Hilary. Thank you, Peter. Francis?
Thanks, Chair. Peter's picked up one of my questions on the sickness. The other one was just on the out of area placement and just the growing gap. I mean, it did come down month before last, but it's picked up again. It just seems to be a growing gap between the target, which is heading down to, well, it's supposed to be 0, and the numbers. And A, do we need to readjust the target for next year, and B, where are we going with that? That's all.
Okay, somebody answer that.
I'll pick that up, Chair, if that's okay.
Thanks, Lynn.
So what's very interesting, Francis, older people's aside, so just so you're aware, because of the building works at Maester Lodge, we have decanted and are using a small number of beds at Navigo for older people. So obviously that's impacting the rise in use of out of area beds. Obviously that's time limited. It will come to an end when the new beds are available. In fact, it shouldn't be too long. We're going to reopen some of the beds before the new pod at Maester is complete. So that's one aspect of that. When we look at the out of area bed usage for adult mental health service users, actually, if we had all of the beds open as we did before COVID, obviously we've got a number reduced. So we've got the Millview Court pod, obviously as a cohort unit. Thankfully, no service users in there currently. So when you look at the bed usage overall, actually we're not using more beds than our full complement of beds. It is the impact of COVID that's impacted that. So, you know, obviously we're being cautious around the restrictions. We'll need to keep that in view. Undoubtedly, there has been some increase in demand as well. So interestingly, over the Easter bank holiday weekend, we saw that it just seemed to be plateauing again at the moment, which is good. So it's something that we're watching very closely. But I think with the reduction, you know, towards the year end, I think we need to reassess where we are again with that, with the COVID arrangements. So I'm confident we will see some reduction further over the coming few months for the reasons that I've said. But as I say, we need to continue to monitor it.
Can I just come in there? I know there's some hands, but it's on this it's on this subject, but absolutely, and it's obviously one of the things that we monitor constantly. And one of the things that the NHS total plan is about how we start to reopen beds across the patch, because it is obviously something that we don't want to happen. But just to reiterate and just remind the board that actually our pathway for acute is exceptionally good and exceptionally efficient. In fact, so much I've been asked to speak at a national, well, it's a regional, semi-regional, semi-national conference about actually our pathway, because actually per population our bed numbers are low, but yeah, our delayed discharges and our throughput is exceptionally high, and our bed occupancy is relatively stable. So, and that's with increasing demand as well. So I think it is mainly down to the COVID piece, but we can't just obviously keep resting on that laurel, so we'll keep doing it. But just to remind ourselves that the pathway is very, very efficient and very good. And again, I thank staff and everybody that's involved with that.
Okay, thank you. Thanks, Francis, for the question. It was one I was going to ask, so that's good. Dean?
Thanks very much. And once again, lots of good stuff in the report, isn't there, in terms of progress in lots of areas, particularly around the workforce stuff. So just to note, I suppose that we've got vacancies falling, turnover is tracking downwards, and sickness absence is coming downwards. I recognise you realise there'll be a but here. So just looking ahead into the finance report as well, Peter, but agency spend is continuing to rise, and it kind of feels odd if we've got the other trends going the other way. And I just wonder if there's some opportunities, given the the things we were saying earlier about changes in policies of converting some of the agency into bank or substantive employment and different ways of working, and whether there's a sort of opportunity with some of the workforce indicators trending in the right direction to have a relook at agency again.
Good point, Dean. Steve or Pete?
Yeah, if you want me to go first, Pete, and then pick up. So yeah, I think so thanks, Dean. Yeah, I think some really positive workforce data in there. So 220 more staff in the organisation at the end of this March compared to a year ago, and I think really importantly in that 37 more nurses as well. So that focus that we've had on that, of course, what that's done, Dean, in a good way, is helped reduce the agency spend actually around nursing and outside of medical is the same, I think, Peter, if not coming down. Our real pressure is on medics and consultants, and as we know through the workforce committee, that kind of the vacancies that we have in that part of the workforce is still high and has remained high, albeit that we've got lots of good work that's going on, and we have a number of offers made. I think 5 offers to consultants to join. So certainly isn't through the lack of trying around that. But Pete will have the details. But my feel is that that's predominantly medical spending rather than in the other areas.
Thanks, Dave. Pete?
I think Steve said pretty much what I would have said. I think the bulk, 2/3 of the spend of our agency is on medics, and I would have just highlighted, we have got the paper later today on the medical recruitment.
Yeah, no, thank you for that. Steve, you had your hand up anyway. Is there anything else you'd like to add?
I was just going to pick up the positive about the vacancies, Sharon, so I've covered that. Thank you.
No, thank you. It is, isn't it? It is a very positive picture compared to previous, particularly, as you say, with certain areas like nursing, for example, but generally getting so many people in the organisation and increasing numbers, really good. And as others have already mentioned, the positive trends with training and sickness, good to see. Just before we leave the performance report, John, obviously we've got mortality in here again, this particular one. We've had some discussions before, and I know you bring back more detailed reports to the board from time to time. Is there anything, John, you'd like to add or highlight in relation to the mortality information?
Sharon, yes, thank you. As we've discussed at the previous board, we're going to bring, I think it's a paper to the June board, which will give a comprehensive review on mortality throughout the year, which will just build on what we did at the 6-month point during the COVID period. So, you can look at it, you can see the 2 obvious spikes. Those are 2 spikes of ours, which sort of follow the national pattern, but we'll bring that sort of detail back to, I think it's scheduled for a June board when we can have a look at it and get, give that sort of public health view in it, so to speak, as well as the wider health inequalities view. I think what I would say is that what we saw with the second wave appears to be mirroring the first wave, but look, we'll bring that back in the paper.
Thanks, John. That'd be really helpful. And Jenny, if we could just check that time frame with John outside the meeting, that'd be really helpful. Thank you very much. Okay, then if we move on, please, to item 10, which is the finance report. Pete.
Thank you, Chair. So this is the finance report for the end of the financial year, and I'd just like to probably thank my finance team for all the hard work at this point. We're in the thick of the annual accounts process now. So if I pull some key points out and then have to put to questions. So we'll note reports a little less detail than we usually report to the board, and that's due to the number of year-end transactions that occurred in March, which would have put out some significant variances, against the budget. So that's the reason for it being slightly less detailed. The key points I pull out are, as a trust, we have met our financial target and delivered a minor operational surplus, which is really positive. And after the application of impairment and donated asset depreciation, which don't count against our control total, we have posted a financial deficit of 620,000. Within the paper, I've highlighted a couple of key accounting entries that are in the position, and I'll just run through those very quickly. So the annual leave accrual, so we have put an annual leave accrual into our position, and that has been funded by NHS England, and we've actually received 80% of the cash for that accrual already. We've got a provision in our accounts for flowers, and just for a bit of context, because it's probably a little bit light in the paper, the flowers case relates to holiday pay for staff who work regular overtime, and there's an expectation that corrective payments will now be made for some eligible staff. There's a national calculation and some funding is being provided, and we're awaiting detailed guidance for us to make those corrective payments with an expectation that that cash will be transacted by the end of September this year. And we've continued to have a provision in our accounts for bad and doubtful debts, which is a very prudent approach to take, and it's pleasing we've got that risk cover. And I was going to mention agency spend, because obviously we have spent a significant amount then last year, but we covered that in the last paper, Chair. So I will stop there, and I'm happy to take any questions.
Thanks, Pete. Mike Cook.
It's a general comment. Well done. It's the best outturn yet. And yes, we've talked about agency. Yes, we've talked about waiting times. But if you look at performance and finance together, and I hope quality, it's the best outturn yet. So well done to the team.
Thanks, Mike. Anything else on the finance report? No, thank you. I know that we've got the finance assurance report coming up shortly. So thanks for that, Pete. I've realised before we move on, slight oversight, partly because it wasn't on the front cover, but my apologies. In the Chief Executive's report, we were asked to ratify a policy, the COVID vaccination handling and management policy. As I say, it wasn't on the front sheet, but I know it's in the report. So are we happy to do that, board members? Happy to ratify that policy? Yes. Any dissensions? No. Apologies, Jenny. Just missed that. So if we could just report that. So if we could move on, please, to item 11, the Finance and Investment Committee Assurance Report. Francis.
Thank you, Chair. It's slightly longer than normal because it was the year end, as Pete said, and we covered a lot of ground. You could see there was quite a lot of reports came in, so slightly longer than usual, but I thought it was right to keep the board informed because there's quite a few key issues there. Pick out a couple of key ones. You can see from the Insight report where the Humber Coast and Vale ICS are, and the fact that they're looking after adjustments to turn out a 5.6 million surplus at the year end. The second one from the Insight report that we pulled out, which was quite important, was the fact that NHS and are consulting on a new oversight framework which would look on a system basis. So it was something we just need to think about. And the third point from that around the fact that a lot of trusts are now struggling to get external auditors to actually audit their accounts. We were lucky to get in with Mazars, but there's quite a few now starting to struggle to get auditors. It's becoming a real issue for NHS trusts going forward because they don't see it as work that is good work for them. I was going to pick up on cash balance, but Pete's done that, so I won't go on there. I thought we should compliment the whole of the trust and everybody for the excellent work on BRS. You know, we've delivered a good BRS saving this year despite COVID, when a lot of trusts haven't done that, which I think needs picking up. We also heard about the plans for next year, and the fact that they will definitely go to the quality committee at the earliest time possible for the quality committee to check them from a QIA. I think some will definitely come, Mike, to your next one, with a couple coming to the one after that, but they're all due to come through to you. We also had a look at the draft budget for next year, but that's on the agenda, and so we'll pick that up, although we as a committee did ask questions around recruitment and the vacancy element within there, because we wanted to make sure that there was enough in there to staff at the right level, and got good assurance on that from the team. The other thing I would pick out then is the estate strategy. So we had a good look at the summary of the estates strategy and had a good discussion on that, and asked a few questions around what was going on there. And there is a reboot of that estate strategy to come through to us. We also had the Sustainable Development Management Plan, which showed some really good work by the team in terms of what they're doing there. We've already discussed the capital programme, and it's in there, and we've attached a bit of detail so that people can see it. And it's really, really good news that we're able to have the kind of money we've got this next coming year to invest. So we did ask a couple of questions about the Humber Centre investment, and we're assured that that scheme would go through the normal governance procedures, because it's quite a big amount of spend. So obviously that would have to go through normal governance procedures. Those are the key things I'll pull out, Chair.
Thanks, Francis. A really comprehensive report. Thank you very much. Any questions? Pete, is there anything you want to add?
I would have brought up capital again, Sharon, and it's not often you get an excited doff, but I think it's the most exciting capital programme I've seen since my time at the Trust. And I think I would have pulled out just a couple of quick highlights. The sale of Hallgate completed in the beginning of April, and the sale of Victoria House is due to complete this week. So that's positive, that's funding the capital programme. And the works at Cottingham Clinic, if I can even say it, have completed. And I think that's a really good outcome. There'll be a bit of bedding down, but again, that's a really positive piece of work. And I'll stop there. Thank you.
No, thank you very much. Any other questions, comments? Yes, Michelle Hughes.
Just to briefly say, Chair, that it references the committee's effectiveness review. It's not on today's agenda. It's coming as a composite report from all committees to the May board.
Yes, thank you for bringing that to our attention, Michelle. Yes, I know they're all circulating around all the committees, etc. So thank you. Anything else on that? I just had a question, I can't find it in the paper now, on the Scarborough situation, but I can pick that up outside of the meeting. So thank you for that. Okay, so if we move on then please to item 12, the Quality Committee Assurance Report and Minutes, Mike Cook.
Thank you, Sharon. Just 5 points to make about the meeting on the 7th of April, which was our last one, and the minutes for the February meeting also with you. The first point is we had a really good discussion on harm minimisation. If you like, how do you create better built environments, and the balance between the therapeutic environment, i.e. the atmosphere and the care and the attitudes and enabling attitudes of staff, as well as the actual building in light of ligature point is usually the language. So there's definitely a move to reframe that. Delighted to say Tracy Flanagan's involved in that national group, and we will be doing all we can to make sure the early findings of that group are helping our design for the future in the campus. The second point was we had a good debate on waiting list trajectories, and I think I did say that I felt with Claire's expertise from the acute sector, we felt to have a harder grip on it than we'd had before, and that's always needed. So fresh eyes and all that, but I think there are, it's going to take a while because it's a wicked problem, but I think we've got somebody in place now who really does understand it and knows how the unintended consequences of actions can undermine progress at times. So we look forward to seeing that again, but that was a good debate with Lynn and Claire. I just wanted to underline that we are up to date on our clinical policies. We think that's really important. Hilary and John are really good at that. And to commend the policy we've just approved, actually. We had a good look at it, but the vaccination immunisation approach has been a real success here. And Wheeler has done a fantastic job in producing a policy. So well done, Dr. Chong and Dr. Byrne on that one. The quality priorities look a bit samey, but there is some stretch in them, Francis, and we are looking for some good measurements to come back. So we've got an eye on that. But we felt with 4 in place rather than 3, we should just try and do more of the same to follow on the progress we've made in a difficult year. So that's the sort of thinking behind that for 21-22 priorities. We also looked at terms of reference of both the feeder groups, which are working really well. QPAS is really the workhorse of quality in the organisation, and with its feeder groups is working very well, as is drugs and therapeutics. So thanks for all the efforts of the teams into those groups. I don't know if there's anything else you want to add, Hilary or John, but that was quality in a nutshell.
I'll just add around the work, the national work that Tracy's involved in, which Mike has just said about the minimising self-harm in built environments. So it was national leaders across England that work's going on with the CQC as well. So we're sort of really working together with the CQC, and it's really good that we're involved in that. So we're sort of on the leading edge of that work, and as Mike says, we can bring that into our organisation as that work rolls forward.
Thank you. Thanks very much. Thanks for that additional narrative, Mike. Really useful. John? I think you must be on mute, John.
Thanks, Sharon. Look, it was remiss of me. I just want to link Mike's point about the quality of a state in terms of patient safety and also staff well-being, because they are interlinked. And what I forgot to mention with regard to the finance paper that Pete and Francis brought was the completion of the work of the Cottingham site, where we have combined 3 surgeries into one enhanced and new site. It's a fabulous facility from a patient perspective and also for staff perspective, and it just shows you what we'll be able to do in Bridlington. But that key point is that actually the quality and the fabric of our state does play a key role in safety and well-being of both patients. And I just want to, and staff, and I just want to flag that work in Cottingham, lest it passes by just in the minutes, because it's been a phenomenal job led by the estates team, but actually great work from the clinicians on the ground, because moving from site to site to site as they've had to do to get this work done in terms of the decanting is a fabulous effort. So I think just important that we capture that success, which is a no means success, I can say.
No, thanks for John. That's a really good point, and it is a big undertaking, so fantastic achievement, as you say. And we heard from our patient about the impact that a positive estate has on wellbeing earlier, didn't we? So absolutely good point to make. Okay, I think if everybody is fine, we'll just have a short break, a comfort break. So if we could come back in at, we'll just have 10 minutes. So if we could come back at 11:08 precisely, that would be helpful. Adam, could we stop streaming, please? And we'll see you all in 10 minutes. Thank you. Okay, welcome back everybody. If we could recommence the meeting and start with item 13, which is the Charitable Funds Committee Assurance Report and Minutes. Peter.
Thank you, Sharon. Yeah, this meeting was held on the afternoon of the last board meeting. So Mike, unfortunately, he was unable to make it because he was moving house. So I stood in as chair. And just picking up 2 or 3 things. I mean, we've got the agenda item later to go through the KPI suggestions for 21-22, so I won't dwell too much on that. We started a discussion on Whitby, talking a little bit about the landscaping and everything that they've got planned there with the charitable funds that we are looking to raise there. But we got into a little bit too much operational detail, so we decided to defer that to a later date for a deeper discussion, but more of a big picture rather than getting into operational detail. So that is really yet to come in terms of the detail of that. We had a good paper on the BAME Wellbeing project, which is the money that we got from Sir Tom Moore's collection on charities together. So that was well received. And the other thing I'd perhaps note for you is that on the circle of wishes, the actual number coming through is extremely low at the moment. It was at the time of the meeting. Just to say that probably is an area that we need to refocus on and maybe reboot a bit once we get past the worst of COVID and back sort of being together maybe a little bit more. But I think those were the main things. I know Steve's got his hand up, so perhaps he'd like to expand on that.
Yeah, thanks, Peter. Steve.
Yeah, thanks, Sharon, and thanks for stepping in, Peter, for that particular meeting. Just on the part around the wishes, I'd absolutely agree with Peter. So kind of good news on that. We actually earlier this week, Mandy Dawley's been working her magic, and we had 93 wishes that have landed with the team from there. So Mandy's done absolutely everything that we want, which is fantastic. So I really sense an energy that's starting to build in the organisation about how we best spend this money to support our patients and support our staff. So already we're starting to see some of the work that we flagged up in that committee meeting. So good news, positive, and hopefully when we get to the May meeting, we'll be able to say how many of those have been supported and give a more favourable update to the committee.
Thanks, Dave. That's useful. Any questions on this before I move on? And obviously, as you say, we've got a paper on the KPIs, which includes some of this later on. OK, thank you. If we can move on, please, to item 14, which is the Humber Coast and Vale Commissioning Committee Assurance Report. Peter.
OK, you stay with me for that one as well. Yeah, we had a really good meeting at the end of March on this. Obviously, we all know that the go live date is very much set in stone for the 1st of July. So everybody's working really hard for that. I would say that the work on the work streams is going really well, and the leads for that come into the meeting and give their updates, and they've got very clear 0 to 6 months, 6 to 12 months and beyond plans for each of the 3 work streams that we've got going in the provider collaborative so far. So I think that part of it is working well. On quality, we still got to develop a quality dashboard, but we have had good assurance on quality, and we are out to employ a quality lead. But I think so far we've had limited success with that, so we may have to rethink about how we approach getting that resource into position. So more on that maybe at a future date. The partnership agreement, we've got a discussion on that later on as a board. Go live date I mentioned. I think that's probably it for now, but as a committee, as I say, it's bedded in really quickly. It was only the March meeting, and there's another one next week, and the work papers, the work plan, the risk register, all that's in place, just as in all the other committees that are in the organisation. So it's really up and running very, very quickly. And ready to go live on the 1st of July, subject to a couple of things, including partnership agreements and obviously the due diligence on finance.
Thank you, Peter. Michelle?
No, I endorse everything that Peter says, and just thank you to Peter as well, because obviously it's a brand new committee, and obviously that takes time, and it's obviously a little bit more difficult because it's fluid at the moment. It's not solid, and we are, you know, working within very different parameters. So thanks to Peter as well, but also thanks to the team, because it is really beginning to get that governance and established committee. So I'm really impressed with how quickly we've done that. So thanks to everybody.
Thanks, Michelle. Dean?
Thanks very much. A really helpful update. Thank you, Peter. It's Mike Cook's opportunity to put me down as a pedant now. I was just wondering, Peter, just in terms of the executive summary, where it's got us down there as the it says as the lead provider. I wonder, given we've still got the due diligence and things that you talk about later in there, whether it's something like shadow lead provider or potential lead provider or something like that. It just gives the impression, I think, in the executive summary that it's established and that's what we're doing. And I know we've still got a process to go through. So I know it might be a pedantic point, but maybe worth just capturing something like that.
Yep. Okay.
Yeah.
Okay, Dean. That's great. Thanks for noting that.
Yeah, we can look at it. I wouldn't really like to use the word shadow, because we're not in shadow form either. I think it's before that. It's probably like named lead provider or something like that. But the language is important. I've actually just said that we probably need to call it something different, because with the provider collaboratives developing across the integrated care system, it does get really confusing as to what we're talking about, because this is a commissioning piece, whereas the provider collaboratives that are developing is around provision initially and how you provide that service. So it just gets a little bit clunky. So, but really good point, Dean. We'll take it away.
Yes, it is a good point. I know what you mean, Dean. There's still a process to go through, so you just need the language to reflect there's still a process to go through. So it is a good point. Now, I know that Trish has joined us, but I don't think Clarissa is quite with us yet. So Trish, if you just bear with us, we'll wait till Clarissa attends as well. So if we can move on to item 15, which is the COVID report, Lynn.
Yes, thank you very much, Chair. So the usual report, I have added into the introductory section. Obviously, we have received the planning guidance, the operational guidance priorities now, and obviously they do connect to the sort of recovery, restore elements of where we are with the pandemic right now, particularly the focus on acute hospitals, restoration of elective services, which obviously has a direct impact on our services too. Otherwise, obviously, what we saw in that report is that the infection rates are reducing, which is good news. Now, I know there has been a little bit of a rise in some places as the restrictions are reduced, but obviously we are seeing the overall impact on reduction of sickness absence, which we've already touched on today. We still are seeing some areas of increased demand across some of our service areas. They are continuing really from where we are last month. So particularly mental health services, Scarborough and Rydale, particularly community services, which obviously is connected to that sort of elective recovery we've already touched on. Primary care for very similar reasons, obviously now seeing sort of that what was suppressed demand sort of coming through, but again connected to the elective recovery too, and at the same while obviously continuing to undertake the COVID vaccination programs. So really sort of obviously continuing to monitor impact of that across our services and to operationally respond to those within the plans that we already had in place. Touched on CAMS obviously with our story this morning, so continuing to see surge in demand for CAMS services, particularly around eating disorders in East Riding. So again, lots of conversations with the commissioners around sort of what more we can do to support that overall position that's been seen nationally as well in terms of rising demand that Michelle's already touched on. That has reduced to a degree, but I think we'd all want to see sort of further improvement, particularly in that demand for Tier 4 beds. I will probably sort of the rest of the report, the position is stable overall, no issues with PPE, those sorts of issues. However, I'll let John comment if he wishes to, particularly around the staff vaccination programme now that we have completed the second dose. I won't steal his thunder there.
Thanks, Lynn. John, do you wish to add anything before we move to question? No, should we move to, unless you're on mute, John, but should we move to questions? Are there any questions for Lynn? It's a very comprehensive report. And we're quite well briefed, I think, through the minutes. So thank you very much for the update, Lynn, appreciated. If we could just stay with you then, Lynn, and move to the Emergency Preparedness Annual Assurance Report. Obviously, we haven't got Mike Smith here today, but if you could just mention Mike's involvement as well for the minutes, that would be helpful, Lynn. Thanks.
So yes, thank you very much, Chair. So pick that point up first. So we had shared this report with Mike prior to it being signed off to come to board today. So he has had sight of it. He was happy with it. So again, connects to the COVID report just touched on. So you know, what a year really to produce an annual report in relation to emergency planning. I think we can hopefully all agree that it's been a test of our emergency preparedness and planning, to say the very least. So, and obviously the report sort of covers that, really covers the sort of EPR work, you know, not just internally within the trust, but how we've connected to the appropriate groups and forums where the planning has taken place across our geographical area. So, and I guess the other point to note particularly is, whilst we weren't fully compliant with the EPR core standards last year because we hadn't undertaken the required training, we had that in plan, but we hadn't delivered it at that point. So we are now assessing ourselves as being fully compliant. The process was a little different. It was a self-assessment process, sort of slightly reduced in demand for last year, but nevertheless, really pleasing to be able to report that we are fully compliant now, because we did deliver that training. And the training we did deliver was to our directors on call predominantly, particularly around joint decision model training. And indeed, since the report was written, we've undertaken and participated in further training since then too. So it's a good positive from that perspective. So obviously happy to take any questions.
Thanks, Lynn. And as you say, what a year to have tested it out, really. But
Yes.
yeah, and I know there's an awful lot of work goes behind this report and throughout the year. So thank you to you and your team for that. Any questions or comments? Peter Barron.
Yeah, thanks, Lynn. I think it's a really great report and really well done in such a difficult year to produce such a fantastic score as this. And, you know, so many greens. I just wanted to ask about one thing you don't mention here. It's possibly not within the scope of this. Is in relation to cyber attacks and whether we've done any testing of any of our IT systems in you know, because it was about 2-3 years ago when we had quite a large cyber attack on the NHS, and that's the sort of thing which, you know, you don't see it coming, do you? But it could come again, something like that. And I just wonder what testing we've done, you know, as part of our resilience and you know, our training and everything else that goes with it to see if that happened again, what would the effect be, and are we still resilient just as much as a new attack that we might have from flood or whatever else?
Yes, thanks, Peter. That's a really good question. Obviously, cybersecurity and resilience obviously is within the remit of EPRR, but actually there has been quite a lot of work done this year. I'll let Pete come in and just explain some of that in terms of the testing that has happened. Pete?
Yeah, no worries, Lynn. So as part of the audit programme, Peter, we do penetration testing of the network. That provides a level of assurance. Often it may provide a level of some recommendations that tend to get implemented relatively quickly, where we do sometimes identify a process or a procedure that needs addressing. Running alongside that, we have countermeasures in place that we report to the board regularly to look at. You know, you'll recall probably earlier this financial year, we had the distributed denial of service attacks on the network that were running slow, and we introduced some countermeasures with our network supplier on that. And I guess running alongside that, we have the cyber operational readiness support assessment and action plan that we work through on a monthly basis and report it to the audit committee. So, you know, we try and put as much assurance out there as we can, but, you know, we know cyber crime becomes an issue, and we know, you know, the cyber criminals, if that's the right terminology, get cleverer and cleverer. but we do test our network on a regular basis.
Thanks, Pete. I think we had something either to the board or to audit quite recently, didn't we? I remember seeing a report on the attempts and what's been done. Just as Mike Smith is our non-exec lead for emergency preparedness, Francis is our non-exec lead for cyber, aren't you, Francis?
Yes, Sharon, and it is something I'll pick up with Pete, and it is something that we pick up on irregular basis at the Finance and Investment Committee. Peter's point is well made, and there is some stuff from, as Pete said later on, about some of the work that's been going on from a cybersecurity perspective. So, but yes, I do pick that up with him. Thanks very much for that. Thanks for the report, Lynn. So we're asked to note it. So duly received and noticed, and as I say, thanks to everybody involved, because I know it's a lot of work goes into producing there. So if we could move on to item 17, and I'm delighted to welcome Trish and Clarissa to the board. I happened to be at the Quality Committee when this was commended to the board and heard this presentation. I have to say I'm still looking forward to hearing about it again, Trish, because it was a fantastic piece of work. So welcome to both of you. Thank you very much for having the time to come and join us this afternoon. So without further ado, Hilary, would you like to introduce this?
Yes, thank you, Sharon. Get really pleased to present the first strategic framework for autism for our trust, which was produced in consultation with staff, patients, experts by experience, carers, in a time of a pandemic, which is again fantastic that this work, we've still got the eye on the ball, we're still pressing ahead with our services and getting those developments in. I think I've asked Clarissa and Trish today to give a little bit of an overview of the strategic framework, but also some of the work that's been done since it was approved at the Quality Committee in February, where it was really well received. So over to Trish and Clarissa.
Okay, Clarissa, do you want to run through the presentation?
That's fine.
I mean, I think I want to start by saying you're absolutely right. During the pandemic, we were taken aback by the level of engagement, Clarissa, and the willingness of people to get involved with this work. And the work we've done since, well, I'm not taking the credit for this, the work Clarissa has done since has been absolutely outstanding. And we had a meeting only this week to look at the action plan. And again, really good engagement across the trust.
Brilliant. So I'll do the caveat that my dog has decided to be a little bit of a monkey today. So if she suddenly starts barking, I do apologise. She's just timed it. So I'm really pleased to come this morning and present the Humber Autism Strategic Framework. Apologies if it's a little bit repetitive for some people. I know some people are at the Quality Committee, but it's good to go over it again. For those that don't know me, my name's Clarissa and I'm an occupational therapist by background. I've worked in quite a lot of different settings, so in paediatrics and adults, community and acute, and most recently in learning disabilities and in the adult autism diagnostic service. And for the last year, I was on secondment as the autism access lead, and really that post was about producing a report that's looking at gaps in services that influence the mental health of autistic people. And really what came from that project, well, the data that I gathered was done through consultation with autistic people, like Hilary mentioned, so through surveys, interviews, attending Matthews Hub, with carers, also with the staff of the trust, and a really comprehensive literature review about the policy and strategy documents out there. And actually what came back was not just about mental health, it was about using health services in general and people's experiences. So I was able to really use all that information to sort of form the core themes for the strategic framework and really develop it. So the strategic framework is really, it's made up of three main components: understands, accepts and supports. And what's really important is that this framework sits within the umbrella of neurodiversity. And that's a relatively new, I guess, term that people are using more frequently now. But what it is understanding that autism is something to be celebrated. It's an individual difference, and it's moving away from the medical model of the past that perhaps people needed treated or something needed changed. And the big thing for us as an organisation is that as health professionals, we need to be looking at what we can do to adapt our practice rather than autistic people thinking what they have to do to try and access our services. in terms of the priority areas, just to briefly recap, so understands autism is really that about understanding that knowledge base about autism, and also that confidence for staff when they're working with autistic patients to feel that they'll be able to give them the care that they want to. Accepts autism is really about the interaction between services and autistic people. So things like the pathway to diagnosis, making sure that that's really streamlined, working with different services to make sure people aren't excluded because they've got a diagnosis of autism. So that's really important. And then supports autism really is about, as an organisation, promoting neurodiversity, involving autistic people and making sure that autistic voices in some, the decisions that are being made throughout, and looking also in terms of opportunities, professional and voluntary roles within the organisation. So who's it for? It's for everybody, basically, with a diagnosis of autism. So covering everybody in Humber, it's for all. And just briefly about why it's so important at the moment. The estimate is 1% of the population is autistic, and that's quite an old study, but it's the one that's still quoted in all the policy documents. But the likelihood is it's a bit more than that. Which means we do have a massive autistic community in East Riding and Hull and the parts of North Yorkshire. There's quite a lot of people out there who are autistic. The health of autistic people have been recognised as a priority in the NHS long-term plan, and that's things like improving waiting times for diagnosis, improving access to training, improving services, and the strategic framework really complements the NHS long-term plan goals, which is great. And the big thing is autistic people, the research has shown there is a higher prevalence of mental health illness and poor physical health outcomes for autistic people, and 8 in 10 autistic people will experience a mental health illness, and that really means that these people are going to be using our services and they are going to be accessing them. So we really need to make sure that we can support them in the best way. So a little bit of progress update, and this is just a snapshot. There's lots of little pockets of work going on at the moment with relation to this. So the strategy was approved in February, and lots of bits of work have been going on. One of the bigger pieces that's going to be happening is that I've been working with the Learning and Development Department about outlining the training programme that we're going to look at, and hopefully definitely as we go along, we'll be involving autistic people in sort of the content and also looking at how they can get involved in delivery and things like that. So we're working on that at the moment, and the hope is really expanding that as well as a learning package beyond Humber to the wider Transforming Care partnership area, which is really exciting that Humber's sort of going to be leading the way about what we should be doing and sort of sharing that training, which is really, really exciting. The Adult Autism Diagnostic Service is offering consultation to other teams, to other services, and they've done a lot of work with other sort of mental health teams. And what we're working on at the moment is sort of spreading the word about that, so people know how to engage if they would like support. And the piece of work that I mentioned that I originally started off, so the Autism and Mental Health Services project. So I've wrapped that up, and I've just submitted the report a couple of weeks ago, and it's got lots of outcomes in it in terms of improving accessibility to services and thinking of new ways of working. And if anybody wants to hear more about that, I'm more than happy to discuss at another time. But that's really exciting, hopefully, again, about improving access to services. There's been a lot of work going on in the actual diagnostic team. So in the adults team, we've looked at making our service more accessible, so creating an email address, simple things like that. But also there's we're trialing a new way of working, which is dramatically affecting our waiting times, which is brilliant. So we're rolling that out at the moment. And there's also been a big piece of work around people who are young people who are waiting for diagnosis, who are sort of fitting that transition, and that's between the children's and adults teams. So we're working together again to improve waiting times and to try and get them a service like a little bit quicker. In terms of patient involvement, like I mentioned, they'll be getting involved in training, and wherever is possible. I'm presenting at the PACE Forum in May about the strategic framework, so it's really about spreading the word. I've already taken it to the Hull and East Riding partnership boards, and it was really well received by the autistic community and by the carers at the boards. And we've obviously continued to forge links with Matthew's Hub, and they were really happy with the strategic framework as well. And as they're like one of the main third sector providers for autism, it's really important, and we're doing a lot of work together about how they can support us and how we can support them. So that's it in a nutshell. So I don't know if anyone's got any questions.
Thank you.
Could I just, yeah, sorry, could I just add that we've been given quite a bit of additional funding for the training from the TCP programme board. We've actually shared the framework across the ICS now, so just to confirm that there's a real willingness, I think, across the ICS footprint to work together, which I think is the way forward. And we're certainly having an impact on children's services, which is where we wanted to be with a lifespan service going forward.
It's a fantastic piece of work, and as you say, lots of. I mean, you've just scratched the surface here, I know today, but it is a really amazing piece of work. So I know quite a few of us have seen it, but I'm sure there'll be a few questions or comments. Any questions or comments from anybody? Peter Barron.
Yeah, thanks, Sharon. Yeah, I really enjoyed reading this and hearing the presentation as well. It's such an important area, isn't it? And I'm sure all of us know people who are autistic. I certainly do. And with the young man who lives down from me, it's really important for him to have a job. So he's got a job at a local garden nursery, and he seems to really enjoy that. And it's something, when I meet him in the street or whatever, I can talk to him about, and he's really focused on that. It's difficult for him to focus on other things if I've talked to him about that. But I just wondered, with the wider working in the system and with other organisations, is it something that is within our remit to help people with perhaps the milder forms of autism to reach some employment sort of careers, if you like, that they can cope with? Is that something that we do?
We actually do employ quite a few autistic people, actually, and we do have some individuals who are employees who've actually come forward for confirmation of diagnosis, but they actually currently continue to work in our trust. We've taken a few volunteers, autistic people, and that's actually led on to them having some part-time and interim employment as a stepping stone to longer term employment. As part of the ICS, North East Links are working with us because they have kind of an established area of employing not just people with autism but people with learning disability too. So we're all trying to learn from each other, which is a really good way forward. But it's certainly something that Clarissa's considered for the future.
Thanks. Yeah, I've linked in with the Equality and Diversity lead actually at the Trust already, because he's hoping to put together some supporting documents to help people with the reasonable adjustments that they might need in the workplace and how that they can express them. So there is little bits of work going on already with it.
That's great to hear. Mike Cook.
Thank you, Sharon. Clarissa, fantastic piece of work, and probably one of the best manifestations of caring, learning, growing our overall values that I've seen since working at the Trust. It's a super piece of work, very well researched, and I'd encourage you to continue that research, because I think you've definitely got something in that space, and you're chiming with a lot of people who don't understand this area, find it difficult, and I really like the ethos of a meaningful life for those individuals, but also the emphasis on carers and the loved ones, because it's a job for people who support individuals with autism, and some of those individuals have superpowers, undoubtedly, and it's great, a great piece of work, very timely, and this is the sort of thing that I think gives us a situational leadership in the system, Michelle, and I know you're applauding that, but this is a really excellent piece of work. So very well done and good luck with it. And how do we support it, really? You know, I think it is chiming with equality, diversity, health inequalities, very high suicide risk, actually, in this group of individuals. Any other thoughts you've had since doing the action plan? Is there anything else we can do?
Oh, you've caught me on the spot. At the moment, so we're just developing the different work streams to support the different areas. So probably I might have an answer further down the line a little bit with it.
Fine.
We're certainly looking for champions, aren't we? So if there's a champion on the board, that would be a good link.
Yeah.
So we're looking for champions across all services.
Yeah, well, I'm sure we can certainly look at that, Trish. Absolutely. Michelle?
That would be excellent.
Yeah, no, thank you. We will take that up. Both a non-exec and an exec. And I'm happy to be an autism champion. I'll put that out there now. And I think when we started this piece of work off, it's great to see it so good, to be honest. I mean, and so meaningful. So thank you, Clarissa, and thank you for a really good presentation. And I'm really excited about it with my system hat on as well. We can see how we can use it within the system, as Mike alluded to. But coming back to the actual strategy, fantastic, because for me it's everybody's business, and the concentration for me isn't the folk that are working within learning disabilities and autism, it's the wider organisation across. And anyway, I know we've concentrated on Hull and East Riding, but anyway, it's how do we bring this into our community services and our wider services in the organisation, because it is about that autism friendly organisation, or whatever we mean in relationship to the wording of that. But it's an outstanding document, and I really think we just need to maybe push it a bit further to say how do we make this cover the whole of the patch. Because you're right, Clarissa, what you said, it's not just about mental health, and I think that really comes out. So thank you, and the amount of work in there is amazing. And I think it comes back to how we build our premises, are they autism friendly, how we link in as an anchor organisation to employment and education facilities. But for me, the next steps are how we start to embed this. And I think what I'd like to see is how are we going to embed this strategy? How are we going to monitor it? How is it going to make a difference? Because what we don't do here is just write a strategy and put it on a shelf and then get it out in a couple of months' time or a year's time and dust it off. We make sure that they're lived and breathed and embedded. So I'll be really interested, maybe not now, to think about how we start to really embed this in practice. But great piece of work. Thank you so much. It will make a difference.
Thank you.
Thank you. And
I think it's interesting.
Go on, Trish.
I was just going to say it's interesting in terms of touching on primary care, because one of the carers that Clarissa's worked very closely with that actually approached the trust as a complainant has actually come on board with all of the work that we're progressing, and her passion is to ensure that this is picked up in primary care.
I think, I've worked with who everybody said it is a really fantastic piece of work and so needed, I think. And when I'm out and about in the community and in the trust, you hear how much this is needed by families, by people individually. So just huge well done. Thank you ever so much for coming to share it again. And we look forward to following the progress with interest. And if there is anything at all that we can do to support it, please let us know. We'll absolutely follow up on the champions. That's absolutely our pleasure to do so. But if there is anything else as things progress, please do keep us in the loop, and please do, sort of keep in touch about whether we can do something as a board to support it. So thank you very much again, Clarissa and Trish, for coming today. Really appreciate it.
Thank you.
Okay, thank you. Board members, I see that Victoria has joined us. So rather than keep Victoria waiting, would we mind please moving to item 21, which I think is page 215 in your packs. So welcome, Victoria. Thank you very much for joining the board. Delighted to have you with us. And Steve, would you like to introduce this item?
Yeah, sure, Chair. Thank you. Hi, Victoria. So we had a discussion at the previous Charitable Funds Committee to look at the KPIs that we use and that we set health stars. So this process, if you recall, we did this 12 months ago. Next month on the board agenda is the annual report. So performance against those indicators will be included as part of that. And actually on a quarterly basis within the committee, we get an update on their performance. So we had a discussion in that meeting around what we would want to set, understanding where we've been, what we're looking to do. And the general consensus view was that we keep the same indicators that we used for the previous 12 months. It will give us some ability to benchmark performance and see how we are doing. So that was the recommendation of the Charitable Funds Committee, and it's put up to board for consideration.
Hey, I'll just come to Victoria, then Mike, if that's all right. So Victoria, would you like to add anything?
Not much to add, just thank you for inviting me today to come and present and answer any questions. I think we've got an exciting year ahead with the Whitby appeal, and then looking forward to what our next appeal is. You know, we remain as focused on raising the money as we do on spending it, and really excited to see the Circle of Wishes thrive this year. And we've already had huge increase in wishes in the first month of the year, which is great news. And that really gives us the opportunity to bring in more funds. Really pleased to be working with Rachel and the comms team on a comms plan as well. And just as a small but sort of mighty little team, we're excited to work hard and deliver against our KPIs this year.
Thank you, Victoria. Is there anything you'd like to add as chair of Charitable Funds?
I just wish I was small and mighty. Yeah, very good. Thanks, Victoria. I think we probably might return to this when we see the outturn signing off last year and on to next year with the effectiveness report next month. But I think it's good to have these. I think it's work in progress. I think we'd all say that, both in the Health Stars team and the Charitable Funds Committee. So I think any observations to develop them further, and let's get a baseline, and let's get focused on this as a group on what we want out of this Health Stars relationship.
Thank you. Questions? Any questions or comments on this? Michelle?
Yeah, thanks, Chair. Thanks everybody, and thanks Victoria and Health Stars for the work that you're doing. I mean, I do think it is work in progress. So, I mean, I don't want everyone to sign these off yet, because I do think there's probably a bit more to do when we see the outturn report, as Mike said. I mean, I think some of them could be a bit more stretched, to be honest. I mean, for example, patient-centred and staff-centred, 10 wishes from patients to be at least 10 a year, less than one a month. Impact 6 case studies a year, that's one every other year. So I just think, and I suppose people who know me would say this, I just think we probably just need to have a little bit more, stretch in there personally. But I mean, I'm happy with it as it is, but I just think maybe it's something that we need to talk about, maybe at the next Charitable Funds, or maybe next time when we get the outturn report. But it's a good sort of starter for 10. But for me, I would just prefer to see a little bit more in some of them.
Okay, any other questions or comments? No, it was encouraging. I accepted what Michelle's just said, but I actually was really pleased to see wishes from patients added in. I thought that was really good. Can I just ask one? It's a very small question, but I was just, I don't know whether I've missed it. When we talk about the finance bits, the fundraising costs and retaining trust, we say fundraising costs to be below 30% of total expenditure. The remaining 70% expenditure must be for charitable outcomes. But there's an asterisk there. What's the asterisk for? Is it to link to a proviso, or is it just an error asterisk?
Error, sorry, Sharon. Yeah, I think it's just.
No, I didn't know if I'd missed somewhere. It implied that it was obviously linked to some other comment, but that's fine. So we're asked to approve it. Are we happy to do so for now, on the basis that it will be reviewed once the outturn for position for the year ending has taken place? Is that what we're suggesting, Steve?
Yeah, those present at the Charitable Funds Committee in March were comfortable with it on that basis, with a view to reflecting back and looking at the performance which comes to May. So we've got the opportunity to nudge it if we want to then. But yes, the recommendation is we agree these as they stand.
Thank you. Is everybody happy to do that? on that
So
basis?
with the proviso that we look at some stretch targets in there then, Sharon, I think, for me.
Okay, well, if the Charitable Funds Committee could take that away, but for now, we will approve it. Is there any dissension? On that basis that it will be reviewed, the Charitable Funds Committee will look at some stretch targets once the outturn positions know, but for now we will approve it. Thank you. Thank you, Victoria, for joining us as well. Lovely to see you and take care.
Thanks, you, Victoria. Thanks, bye.
Okay, if we could please move them back to item 18, which is the executive summary of our recovery strategy framework. Lynn.
Yes, thank you, Chair. So as you've said, this is the executive summary. The full document is available. Delighted to bring this summary here today, an area I know that the Trust is passionate about, but certainly I'm personally very passionate about. So this new strategic framework for recovery builds on the previous strategy, the Bridging the Gap document. That document gave a great basis for developing recovery approaches across the organisation. I think one of its key objectives was the Recovery College, particularly had been established fairly newly at that point in time, and that Bridging the Gap was really around sort of focusing on developing the Recovery College, particularly further. I think we have done that. I think there has been progress. Obviously, it's brought the Recovery College into sharp focus in COVID, particularly, and how we continue to make that offer available, accessible, and broad to meet those needs. So I guess this new strategic framework perhaps broadens out the work around progressing with recovery as sort of our underpinning framework for how we work with service users across our service areas. The main document itself takes the sort of 7 objectives reported in the executive summary and provides a level of detail around plans over the coming year in terms of how those objectives, principles are going to be delivered. I really want to thank Natalie Belt, some of you know Natalie well, and particularly Lauren Saunders, who a member of our Recovery College staff, but has been seconded temporarily to undertake this work around developing our recovery strategic framework. She's undertaken this utilising the principles, obviously, of co-production through a range of engagements with staff, with service users, with carers, with other stakeholders. So and I say a real depth of work, again, sort of slightly challenged by the COVID position, but I think she's overcome that in really creative ways. What's been really great as well, I think this time is, you know, a step change over the last year or two in the organisation, with a number now of our own staff who are in paid roles with lived experience of mental health issues. So their input into this iteration of the framework as well has been really significant, and I think hopefully it's demonstrated in the work itself. So it is a plan, it's a deliverable plan. The next steps with this are to undertake a number of approaches in order to embed these, you know, further across our organisation. So toolkits have been developed. There will be sort of training, learning opportunities, wider workshops in terms of launching this work going forward. There is a focus on outcomes as well, how we measure the impact of this work too. And obviously it does connect implicitly with some of our wider strategic work across the organisation, particularly Mandy Dawley's work around patient and carer engagement. I think particularly around staff development, particularly around sort of our people's plan work as well. So hopefully it makes those connections explicit too. So I'll stop there. I'm obviously happy to have any questions. Just touch on it hasn't been to the Quality Committee as yet, but the hope is with Mike and Hillary's support, but it will be taken there next time, where I think there's an opportunity to really sort of get into some of the detail of what's sort of broad work that's proposed in this, because there's a lot of actions that are being proposed to take this work forward.
Well, you've answered that question for me, Lynn. I was just going to ask if it had been to the Quality Committee, so thank you for answering that. Francis?
Just a comment. Good to hear it's going to the Quality Committee, and I'm sure Mike and the team will give it a rigorous once over. But it looks really excellent. I'm really impressed with the way that you've consulted with so many people in the workshops and got all that involved. It's great. I mean, again, Mike made a comment earlier on about how good the last presentation was. Same for me with this. To have this framework and to see how recovery is going is really impressive. And congratulations to the team for doing it. Really good.
Thanks, Francis. Mike Cook?
Yeah, just to endorse it, I mean, thanks for some executive leadership on this, Lynn. That's been needed. And I think the broader approach is good, as are the specifics. So my advice is now, can we stick with this? Because we've had a few stops and starts, in my view. I think Lauren's done a really good piece of work, supported by Natalie. On two specifics, you sent me it yesterday, and I did actually read it in full. And yes, we'd like to take it to the Quality Committee in June, but I've asked Hilary if she's happy with that too, and John. There's a word called agency in it. Now, I think I understand recovery as hope, opportunity, and a sense of control, and tackling stigma, which I think also we should think about. And if I can give you an example of that, in priority 5, supporting staff recovery journeys, no better time to have recovery. You know, we walk the talk with our staff as well as our service users and the public. But actually, I'd like to see something about staff having an enabling attitude, not just benefiting from the recovery strategy, but actually facilitating recovery. And that is the biggest block to recovery, in my experience, over many, many years in this space. So it's actually the staff, we train them up to be experts. And they say, well, hand over to me, I'll relieve you of your problems. Actually, recovery is all about enabling the individuals, as we saw beautifully in the autism strategy. So pleased to see it, here to help. And I think Chime is interesting, but you've got quite a few frameworks in the document, and you just need to work out which is the sort of overall one you're going with, because it fits well with caring, learning, growing, which is our approach. But just try and think about the word agencies. A bit odd in my experience, but a lot of people have helped write this document, and that's good that it's been co-produced. But I personally wouldn't understand the word agency, and I think it's jargonistic.
Yeah, it's an interesting one. I really accept your point there. Some of the language has been co-produced as well, Mike. So I think there is a, there is a sort of, place to strike there, isn't there, in making it accessible. I absolutely understand and agree. And, the co-production of the language itself, which is obviously important, as you know, in recovery too. So, yeah.
And recovery is very personal to individuals. So it's allowing that. But I think with the Chime framework, which I did look up and I've not actually heard of before, so maybe that's me being thick. And there are some words in that again which won't engage everybody. So just think about which is the first order thing you want, and then this is great to see. Let's get behind it, but let's stick with it now.
And I'm sure
that's my plea. That's my plea.
No, thanks for that, Mike. And I'm sure the Quality Committee, as Lynn's already mentioned, will be able to have a more detailed discussion than at the board. Michelle?
Yeah, thanks. Great to see this, Lynn, and great work actually in relationship to co-production and putting it together. It's never easy. I do support Mac's point about being an enabler for staff as well. our patients are the experts. So I just think that's in there. The same question, really. Great piece of work, great document, great to see it in the summary form. And I'll leave it to the quality committee, really. Is that how do we start really embedding this and making it absolutely intrinsic to everything that we do, and how do we monitor and actually say it is making a difference? So I'll leave that with you, but I do think it's important at some point the board know from the couple of strategies we've seen today, how is it making a difference to our communities, our population? But another good piece of work, and it's great to see it here.
Thanks,
Thank you,
Sharon. John?
Thanks, Sharon. So I echo a lot of what has been said about the positivity. The thing I just want to note is that we've really moved beyond recovery, just thinking that it's a recovery college, and that development work which has taken place over the last 2 to 3 years, which is great to see, because ultimately in terms of well-being and outcomes for staff and patients and carers, the key thing about recovery is not just being a state of mind, but also understanding how to signpost people to available services, and thinking differently right across the range of services that we offer. And we've talked about this with regard to the social values report, that actually half the time it's about linking people up with some of what you might say are softer services, but are actually the services that will make a meaningful difference to people's lives and experiences, but you can't necessarily count them or put a figure on them in terms of numerical value. And I really like this from an editorial point of view in terms of the way it is to read and in terms of bringing in the trust branding. So I think there's lots to commend it to us as well. So thank you, Lynn and the team who've developed this and actually given us the opportunity for the feedback too.
Thanks, John. Anything else from anybody? No, I have to say I really like the presentation. Mike's, I'll support Mike in terms of running with this now, because it's been not particularly due to any reason or any one individual, but it's been a long time coming to this, hasn't it, Lynn, in terms of not you personally, but to get to this point, to bring this wider view of recovery. So agree with Mike, take it and run with it. It's great to see. I like it. I agree with John. Editorial, it reads really well. I even like the how many people have been involved in it in the document and the strapline. I think that's really positive. So for me, great to see, and I look forward to hearing how the discussions at the Quality Committee go, and as Michelle says, how it becomes embedded and make a real difference, because this is something that we've needed as an approach for a while. So it's fantastic. So I think pass on, please, our thanks to Natalie and to Lauren as well for a piece of work really well done. And let's work with you to make sure it does get embedded and becomes the real fantastic piece of work that it can be, but really good piece and really good to see it then. So thank you for that. Okay, if we could move on please to the item 19, the NHS operational plan summary. Pete.
Apologies, I was on mute first time today, so thank you. So attached is brought to the board just for information really, and summarising what was in the most recent planning guidance for H1 of the new financial year. I think, you know, what's refreshing is just listening to some of the conversation in the board today. Quite a lot of what's in there has already been picked up and covered. You know, so there are 6 key areas in the planning guidance and the details in the report. So strong focus on staff health and wellbeing, and Steve's leading on the recovery plan. Focus on COVID vaccination programme, expanding primary care capacity, and Lynn covered that a little bit in her COVID update report. There's the learning from the pandemic, transforming community and urgent care, and a little bit on working collaboratively, which Michelle is picking up to provide a collaborative work. So we know plans will be submitted at ICS level, and the final plans will go in the beginning of June, and work is progressing on that as I speak. You know, there is quite a bit of detail in the paper, Chair, but I think I'll stop there, and if anybody's got any questions, I'm sure myself or one of my exec colleagues would be able to help.
Thanks, Pete. Any questions for Pete on this? No, I think, as you say, Pete, it's getting discussed in various different committees and things as well, isn't it? I know it's getting discussed elsewhere as well. So thank you very much for bringing the paper, useful paper, Pete. Thank you. If we can move on then to item 20, which is the report on the use of the trust seal. Michelle?
Yeah, Chair, just the usual reporting of when we've used the seal, just for the board to acknowledge and note. It's fairly self-explanatory.
Thank you. Any questions on that? No. Okay, thank you. Duly noted. We've already covered item 21, the Health Stars key performance indicators. So if we could move to item 22, which is the marketing and communications operational plan. Rachel, delighted to join you again to the board. Thank you very much for joining us.
Hello.
So Michelle, would you like to introduce this item?
Yes, thanks, Chair. So I'm using a bit of my chief executive prerogative really, because it's an operational plan really. But we did approve the strategic plan in February. But just partly just so the board can actually just see the enormous amount of work. What is a relatively small, well, it is a small, not a relatively, it is a small team to be fair, cover. And I know that we've said many times it's amazing how we've transformed ourselves in relationship to communication, branding, marketing. So I thought it would be really helpful just for the board to have a look at this. Follows on from the strategy. Remember, we don't keep strategies on the shelf. We bet them live. We embed them just to see how we're taking that forward. Just give us a little bit more detail on the communications work that's in progress, because it is so important, both for externally facing, but also for that internally staff engagement piece. So I'm going to stop there, hand you over to Rachel, just to take you through some of the headlines, and obviously we'll answer any questions between us. But welcome, Rachel, and just in advance, thank you for everything that you and the team are doing. It's amazing what you're doing and how you're doing things. So over to you.
Thank you. Thanks. And sorry, Rachel, just we have read the paper, so just highlights and things you particularly like to know would be great. Thank you.
Yeah, I think what Michelle said was really helpful for an introduction, because it was back in February 2020 that I came to the board and we signed off this plan, which was in line with the trust strategy refresh at the time. And so much has happened over that period, not only in the last year, and we had a lot of big objectives to deliver that we set ourselves, but also against the backdrop of the last 12 months and a real focus from the team on COVID communications and supporting the efforts for the pandemic, as well as delivering some real transformational change in terms of how we approach marketing and communications as a trust. At the beginning of the document, we showed sort of how we're doing against the plans that we set for ourselves, and those targets were 3-year targets, so things that we want to reach by the end of March 2022. And you can see across those, we're achieving in all of those different areas. There's just a couple that I wanted to touch on that we are still working towards, and whilst we're making progress, we're aware we want to do a little bit more, and that's something we'll be focusing on in the next year. That's specifically website bounce rate. So whilst we're bringing those down, they're not coming down maybe as quickly as we want. So what we're trying to understand as a team is any reasons for that. So in terms of our external website, people are going directly to links that have been provided to them. That really impacts on that. And we keep looking at other figures as well to see if, the search work that we've been doing to really improve the search engine optimization, how is that working? And internally, we're refreshing the intranet. So we're doing that, really thinking about the bounce rate. So that's something we're still working towards and we continue to have a focus on. And in terms of our internal communications as well, we're really lucky to have really well engaged staff with our internal communications, and our open rates and click-through rates are well within lines of national benchmarks. But there are some staff groups we continue to have challenges with reaching, our estates team in particular, and also bank staff. So working with staff engagement to really look at those specific groups is really important to us over the next year, to kind of make sure we're continuing to look at how we can reach out to those members of staff. So that's something we also want to look at as well. So I just wanted to draw attention to those two stats in terms of our measures. So what's next for the team in the next year after a big year of delivery on some key projects? And I think sometimes, they're just putting the bullet down there, like, delivering a trust brand doesn't always give credit to the scale of the projects that we've done. But what's next for us after doing some of those big jobs? So I see the next year for us as really embedding that transformational change. A lot's happened. We've got a lot of new things there. We need staff to get used to them, continue to look at how we can move them forwards. And then there's also some projects as well that we want to work on to move those things forward. One is the redevelopment of the intranet. I think the last year has really made us realise how important our internal communications is and how key it is. And what's been lovely for the team is what excellent feedback we've had from our staff, how much they've valued that as well from us. So the internet's kind of, for me, the last thing that we really want to transform, and that's something that we're delivering next month. We're working on that now as a team to really change that and hopefully make it an excellent resource. And we've engaged staff in that throughout. We've had focus groups and things to make sure that we're delivering a platform that meets the needs of our staff. So that's a big project for us. Continuing to monitor and develop the Trust brand. It's not something we can just launch and that it's just going to run and be there. We need to nurture it, look after that, continue to engage staff with it, make sure they're using it correctly. We're holding monthly workshops with staff. I did one just last month that 49 staff attended. Just continuing to show that there's an interest in that. We're measuring uptake of the brand, monitoring it, getting those brand champions on board, who are the people in their areas that really use it, to kind of help them help us to make it something that lives and breathes, and it's not just kind of static and it doesn't go away. Working with Health Stars, we're really keen to work with them to help reach their charitable objectives, support them with fundraising, and let them access the expertise within the team as well. So we've recently written a communications and marketing plan with them to go to the next charitable funds to continue and kind of bring them into the fold as well. You'll be aware of the redevelopment of GP practice websites. Again, it's just another way that we can use our expertise. We don't need to outsource that anymore. Let's bring them in-house, and launching the King Street Medical Centre practice as the first site. If you haven't seen it, it's an excellent website. It's really accessible and easy to use for patients. So that will be rolled out across all the other GP practices that we have within the Trust. The also exciting project that we've just concluded with University of Hull students to launch the patient information platform. So that's a hub for all our patient information within the Trust. Really exciting digital project. And digital is a big focus for us for the next 12 months. How are we going to move on the digital aspects of what we do? We'll have a 12-month digital delivery plan for the Trust for communications, just to make sure we're keeping kind of being innovative and really pushing the boundaries of what we do digitally. And moving on to some of the campaigns, you'll know we've done quite a bit around World Mental Health Day. We want to do more of that, more and bigger, full trust, engaging campaigns. We've got loads planned for Mental Health Awareness Week coming up. So really taking the opportunity of those engagement days that we can really go big on the internal and external communications. And you'll have seen there's some new KPIs to support that. But I think alongside those big objectives, like I said, it's really a year of kind of embedding that change, continuing to make sure that our staff know that we're a central resource for everybody, how they can access it and what we do, and continue to really celebrate the work that the Trust does and raise our profile locally, regionally and nationally remains a big focus for the team.
Thanks, Rachel. Questions, comments? I have to say it. I don't think it does you justice, Rachel. To be fair, and your team. I think you summed it up. I think you're another. We had an expression, small and mighty team earlier. I think yours is another small and mighty team. Peter Barron.
Yeah. Thanks, Sharon. Thanks, Rachel. Yes, that's really great. That's a remarkable amount of progress, given the situation that we've been in the last 12 months. It's really well done. I just wanted to ask, and it may be that it's work in progress, but I just wanted to ask how you thought, or how Michelle thought the annual members meeting might look this year, and what opportunity there might be there to do some relaunching of the brand and putting us on the map again, if you like, as regards local businesses and the staff and everything else. Any initial thoughts on that, or is it still too early to say?
Yeah, I'm happy to pick that up. We've done a brief on that, which obviously will follow previous years from a running order vis-a-vis presenting the annual accounts and Pete doing that, etc., and doing a review of the year. Well, at the moment we're looking to do it online because it's only September, but it depends on what the figures are. What we've done is provisionally held the lecture theatre just to see if we can do something in there in relationship to a few market stalls, all the ones that we normally do. But it just depends on how we continue in relationship to restrictions, footfall, etc., etc. So we're doing both. So we might have probably a bit of a mixture, like people, because obviously we have streamed it in previous years anyway. So we're going to do a bit of that, and the video this year will be our reflections on the year, obviously, and build on the book, etc. So we're keeping foot in both camps at the moment, Peter, and we'll just see how it develops. But it will not be on the scale it has been for the last couple of years, because that number of people coming indoors. I know that we're hoping to reduce restrictions, but we've still got to be careful as a health employer. We don't know what sanctions and what regulations will affect health services. So we're going to keep it open at the moment. We've done the schedule.
I think what's important for any of the digital events that we deliver next year is what we've kind of learned from delivering those digitally previously. So what did we learn from the AMM last year, and how can we, whilst we're delivering it digitally this year, kind of take that on, make it really engaging, and I think that's what we'll look at in terms of delivering a really interesting, engaging virtual / face-to-face event, and that's kind of what the team and I are thinking about now.
And you can still do a lot virtually, because obviously the NHS Confederation have been virtual, have other NHS providers. So there's a lot of learning out there anyway about market stalls and how you do that. So it's probably a little bit of both, I think, is what we're looking at. But we'll certainly do some market stalls virtually as well, Peter. That'll we'll get staff meeting and talking to each other, etc.
Thank you. And so, Mike.
Thank you, Sharon. Rachel, some brilliant work again. I would just suggest a blended approach is good. You know, I didn't understand some of the things you've already done for us, but you know, blending it is good, and I include the annual members meeting. But we had two brilliant presentations that would lend themselves well to putting ourselves on show rather than someone else this time as well. I just wondered, did you have a thought on how recruitment has been helped by your activities? Because my sense is quite a lot. Do you have any actual feedback on that in terms of how the branding and the work you've done to really communicate has actually enhanced what we're able to do now in recruitment?
I think, and Steve will be able to hopefully help answer this and see what he thinks in terms of how it's supported the work of the group. I suppose it's given us some new tools, hasn't it? We've got the website now, so we can really track and see how those things are coming through. It's connected what was the recruitment side of things and the promotional side of things for us, and just given us that really slick face in terms of how we present ourselves to the world and to help people understand the opportunities available of working here. We are starting, working together with Recruitment, a survey for new starters. So after they've been with us a month, they will get a survey to complete, and so they can give us that feedback. Why did you come? What worked well? So we can really learn from that. This year's been about really building up that campaign, building up the resources to kind of help the general recruitment. But I know that the recruitment efforts that Steve's led have been successful this year, and there's some great stats relating to how the group's done. I don't know if you wanted to mention anything, Steve, there about how you think Unbelievable is going to help.
To be honest, Rachel, we probably picked it up earlier in the meeting around the overall recruitment numbers. So, but undoubtedly, you know, it's been a factor in that, undoubtedly.
Thank you, John.
Thanks, Sharon. So firstly, just on the recruitment piece, when we've asked the medics to get involved in the recruitment side, they've been hugely impressed with the quality of the products that we now produce. And I think that's one of the benefits we've had regarding to having, you know, a more sophisticated and driven communication approach, which is just brilliant to see. So whether it's in social media and the various formats, what we now have to sort of say to people, this is who we are, it is brilliant externally, but actually engenders some pride in our own colleagues. So more of that, and I think we've got plans in place. Actually, I'm doing some videoing this afternoon for medical recruitment, and lots of medics are involved over the next week. This is really a question, though, about our membership offering. So I understand that there are certain reports that absolutely we have to print, and the annual accounts would be an example of that. But in terms of what we push out to our membership, I'm just wondering where we got to in terms of taking that towards a digital model, because we've seen that we've produced the social values report as a digital version, and I'm just wondering, you know, do we still plan to pump out an awful lot of paper and to send out to people, and actually what is the value of that, and is it landing? So where I know the membership office has been doing some work, but I'm just wondering where that's got to in terms of how they engage with and communicate with the members and the going digital agenda.
It has very much been on the agenda, and Michelle Hughes has got a hand up, and I'm sure she's ready to answer this question because it's been a topic of many discussions, John, over the last few months. So Michelle, over to you.
It has, thank you, Chair. So we refocused engaging with members group at the beginning of last year, and we recognised that we needed to engage with members in a different way. And to review the paper that we send out to them and how useful it is, because obviously that has a huge expense associated with it. So lots of work going on, and to enhance the work of that group, Adam is a member. And on the agenda for the next meeting, for example, we are going to be talking about different ways of engaging with members, which includes a potential video and bringing to life things in a different way. So it's work in progress, John, but it's definitely something we're on.
It hasn't been helped, John, by the fact that we only have, I think it's about 3,500 email addresses or ways of electronically contacting members. So, for example, there's been even a survey sent out to try and get people to give that kind of information so that we can move from post to actually much more of a digital interaction with people. So lots going on, John, but it wasn't an easy starting point, if you see what I mean. So, Michelle?
Yeah, no, thanks. So thanks for the work on that, and we will get there. And it is about keeping the membership base up to date, I think, as well as keeping it current. Going back to John's point, we haven't actually produced masses of the annual report for the last couple of years, to be honest. We've only done literally a very, very small run print for those people that actually want a hard copy that haven't got access to emails, but everything else has been digital and digitally produced. And we're doing exactly the same this year. So we're only going to have a really small amount that's actually printed in case anybody actually wants a printed copy. And the rest is available digitally. And we'll move more to that, but we just need to be mindful of viewing things in different ways for visually impaired, disabilities, diversity, etc. And obviously that's what Rachel and the team are on with and doing. And I think it's really great that we've got such a menu of options that we can communicate with people, and that will continue to develop, and we'll continue to co-produce it as well. But thank you, and thank you, Rachel, again. I'll leave it there, Sharon.
Thanks. And the other thing, John, just on your point, is that there's Michelle Hughes is very kindly leading on this work, but there's a really increasingly strong link with Mandy's team and with volunteers with membership. So that will help with that more digital format going forward in terms of contacts for people. So I think there's still an awful lot to do, but there has been some really good work done as well. So, but thank you, Rachel. Thank you ever so much for joining us, and thank you to you and your team for the fantastic work that you've been doing. As I say, personally, I think, I mean, it's good to have an update, but I don't think the narrative probably does you justice in terms of what you've achieved. So well done, and lovely to see you. Thank
you. Lovely to see everybody. Bye.
Thanks, Rachel. Thanks, everybody.
So if we just move on to items for escalation, I don't think there are any, unless anybody's got any. No. So any other business? Not aware of any? No. So if we could just close part one of the board meeting, please. Thank you all for your contributions and the discussion, and I think we've had some really good discussions today. Thank you to anybody who's joined us virtually. Really good of you to take the interest and time to join us. And if we could stop now live streaming, Adam, and if you could confirm when that's done. Thank you.